just picking up on some of those healthcare issues, one of the reasons it's particularly inappropriate to house people in hotels in Skegness, for instance, is because the local NHS is not set up for people with those sorts of problems that we've seen with asylum seekers. But it is surely, from what you're saying, the case that the provision of healthcare services on the large sites is not just right for those people, but it is a massively higher standard and a lower waiting list, for instance, than it would be for typical constituents. Is that what you're really saying, and is that a conscious decision that comes from the department?
No. What we're saying is that in order to ensure that we are not adding unnecessarily to the burden which is already strong in a local community, Portland in relation to Bibby, for instance, we are instead providing a bespoke service for the asylum seekers in that site. That doesn't mean that we are aiming to give them preferential access. It means that we are seeking not to have a negative impact on the local access.
But you are giving them a higher standard of care than everyone else could expect.
We're providing the standard of care that is appropriate for their circumstances, which, as your colleague was suggesting, sometimes they are more vulnerable than average. So sometimes it would I think make sense for them to have that. Yes.
Does that mean that in some ways you're suggesting that the standard of care for Joe Public, for want of a better word, is below what it should be?
No, it doesn't mean that at all. It means that asylum seekers on some sites have some needs which are better provided by a bespoke service for the people on that site, in order to detract from the existing service for the existing customers of that service, i.e. the local inhabitants.
But I think we've heard, for instance, that the wait at Wethersfield to see a GP was about an hour, which is great, and I know every one of my constituents would think that was excellent, but that's not what's available. How well do you think you're calibrating what is on offer for people where the need might genuinely not be that urgent?
Well, on the basis of this last 10 minutes, we've got one person who thinks we're doing too much and another who thinks we're doing not enough. So
that's unfair characterisation. It's a fair question from Mr. Warman. How do you decide what resource to provide?
We're not seeking to provide an unnecessarily luxurious amount of support in any sense, whether that's for healthcare or food or anything else. But we are seeking to provide an appropriate amount for people to live in dignity.
Because I think what you've actually heard to characterise what we're saying is that you're not serving the most vulnerable people as well as perhaps you could be, but you are doing the low-hanging fruit too well, if that makes sense. The GP appointment shouldn't be your top priority. It should be the most vulnerable people, surely. And this is a failure of provision, surely.